I'm here today to inform you about pulmonary hypertension. Pulmonary hypertension is a very serious illness which affects the heart and the lungs. It has no cure and is sometimes fatal. What is pulmonary hypertension? How many of you know what pulmonary hypertension is? Most of us have never heard of it. Now that you've heard of it, you probably think that it's your normal blood pressure. It's not. After thorough research, I've gained great knowledge of pulmonary hypertension. I hope that this information will give you knowledge as well. Pulmonary hypertension is a very serious illness that affects the heart and the lungs that is sometimes fatal. According to my research, pulmonary hypertension is described in several ways, but each of my sources' definition adds depth to the others. I'm going to show you an example of a normal heart and a heart that in a patient that has pulmonary hypertension. The picture here on my right is the normal heart. The picture on my left is the heart with pulmonary hypertension.
3.
The Mayo Clinic defines pulmonary hypertension as a type of high blood pressure that affects the arteries in the lungs and the right side of your heart. Pulmonary hypertension is a rare lung disorder in which the arteries from the heart that carry the blood to the lungs become narrowed, making it hard for the blood to flow through the vessels. And that is according to the Cleveland Clinic. Also at heart.org, it adds that pulmonary hypertension reflects the pressure the heart must exert to pump blood to the lungs. Pulmonary hypertension is different from typical blood pressure. Typical blood pressure is systemic, which delivers oxygen throughout the body. Pulmonary receives oxygen from the lungs. Medicine.net explains that the right ventricle pumps blood returning from the body into the pulmonary arteries to the lungs to receive the oxygen. The pressures in the lungs arteries, which are the pulmonary arteries, are normally significantly lower than the pressure in the systemic circulation. When pressure in the pulmonary circulation becomes elevated, it's referred to as pulmonary hypertension. And the experts only give you a life expectancy of 3 to 10 years after pulmonary hypertension is diagnosed. The symptoms of pulmonary hypertension are shortness of breath during exercise and eventually at rest, fatigue, dizziness or fainting, chest pressure or pain, swelling in the ankles, legs, and eventually the abdomen, bluish color to the lips and skin, racing pulse, or heart palpitations. According to the Mayo Clinic, with pulmonary hypertension, the rise in blood pressure is caused by changes in the cells that line your pulmonary arteries. These changes cause extra tissue to form, eventually narrowing or completely blocking the blood vessels, making the arteries stiff and narrow. This makes it harder for blood to flow. Therefore, it raises the blood pressure in the pulmonary arteries. The Cleveland Clinic also lists some causes as genetics, liver diseases, certain heart diseases, low oxygen conditions, and diet drugs. There are several steps to diagnosis. An echocardiogram with the Doppler study is the second step after the patient has experienced the symptoms. A right heart catheterization where oxygen levels are measured is another test. Other tests that show abnormalities would be an ECG, an EKG, and a chest x-ray. In my conclusion, there are many causes and treatments of pulmonary hypertension. Although there is no cure, it can become fatal if left untreated. Pulmonary hypertension is a very serious illness which affects the heart and the lungs that is sometimes fatal. Pulmonary hypertension occurs in individuals of all ages, races, and ethnic backgrounds, but is more common in young adults and approximately twice as common in women as in men. My sources for pulmonary hypertension were clevelandclinic.org, medicine.net, mayoclinic.org, V.V. McLaughlin in 2009 for the Journal of American College of Cardiology, and Anthony S. Fonsi in 2010, the 17th edition of Harrison's Principles of Internal Medicine.